Before that, we have our plenary lecture. It's given by Dr. Rana Sagdazadeh. She is Associate Professor and Co-Director of the Human Design Innovation Lab, which is affiliated with the Institute of Healthy Futures at Cornell University in the United States, and a visiting associate professor at the University of British Columbia in Canada. Her team develops translational solutions, bringing best evidence to practice with a system engineering approach that combines a whole different set of disciplines from engineering to medicine, psychology, business, and policy in partnership with communities, which I think is particularly important. And the outcomes are about supporting the quality of life, equity, especially for aging populations. And Dr. Zadeh is going to talk to us around from human biology to daylight practice and policy of beyond inclusion and longevity. Zadeh, the floor is yours.
Thank you so much. So I'm going to start by summarizing the next 20 minutes, just in case someone snoozes. It's after lunch, or if we are not funny enough. So really the points is we are hoping to summarize the knowledge that we collectively have discussed, which is really that environment mediates our access to daylight. We spend 90% of our time indoors, and that it can hinder or facilitate our access to the basically photonutrition that our biology needs to stay healthy and balanced and optimized. And as we know, and we have learned, daylight modulates neurohormonal mechanisms. It influences our health, and it has a specific effects on biology behavior. So, you know, we learned it leads to alerting effects, daytime sleepiness, sleep quality at night, performance, cognitive functioning, all the way to the circadian rhythm resulting from elements such as daylight, all the way to changes to our biological systems, our immune system, inflammation, cardiovascular system, and more. The other thing we know is that the effects, the positive or negative effects of environment, it affects all of us, but it affects some people more than others. And research indicates potentially people with lower socioeconomic status, vulnerable populations, or older adults are at higher risk of these perturbations and disturbances. The final message of this talk will be basically the message here. It says innovation ahead lies within a collective partnership between policymakers, researchers, and designers and scientists to collectively work together from the bottom up to create solutions that would bring transformative change to environments so that we have better living, working environments, better learning environments. As people age, we have a better quality of life management and aging environments and more. All right, so for fun, this is the photo of the Webb telescope in July 2022, translated into spectrum of light from the different galaxies. We happen to live on Earth, as last time I checked, and we are exposed to our sun based on its chemical composition and year of the star. It has a special spectrum and timing. We are exposed, our biology is exposed to these natural conditions. So we are on this planet and not on that planet. Now, had we been created on that planet where there is constant, low, dim light with limited spectral availability and with no changes throughout the time, if the evolution had helped us to adapt, we would have looked different and our biology would have been different. So because we were, through millions of years of evolution, were adapted to this natural environment, there are three elements of daylight that are innate in our biology. As we have discussed, the intensity and level of daylight matters. The color temperature and spectrum of daylight matters to our biology, to our performance, and yet the timing of that light exposure matters. So if we have blue light in the morning, we have learned, versus the same light if we have been exposed through evening, it has completely different effect on our health. Actually, one may be very harmful. So October 11, 2022, which is 2 days ago, I'm in New York City. I just flew in there, I arrived there to do some work and then come to the conference. So the day looks like this on our Earth. And obviously, how much of this I will be exposed to depends on the officials, the urban regional planning, environment, architecture, policy officials. I'm trying to hide the next slide if it allows me. Practices and adaptation, also how that adaptation was done with the climate conditions. So my exposure to daylight would be mediated by these professionals. So I woke up in this room. It is the Cornell University's club. As you see, oops, the window that I had, that photo is taken at noon when there was a nice sunlight out. And these are my work environments. So this is where the attendees and the residents are meeting in the New York Presbyterian Hospital. And those are the nurses and the office workers in our work environment. As you notice, we didn't get a lot of daylight. So the question for you, and I encourage folks to have a piece of paper because there will be a lot of conversation. The question for you is, what is the biological context that was my piece of the sky? Take a moment to think about it. What is the biological context? So are you ready? I was the whole day in biological darkness. That was my piece of sky. And well, I have some texts for you on this slide, but unfortunately you can't see because we are in biological darkness and our body cannot receive their receptors externally. Our receptors cannot see all the stimulants externally. But don't worry, I will turn on the electric light. We will use some CO2 and we will read the slide text. So daylight's availability in conventional work environments and living environments is not sufficient for the human biology. Therefore, we are kind of constantly trapped in biological darkness. Again, let's not forget, we spend 92% of our time indoors in developed countries, 80% in developing countries. Any good doctor or scientist would tell us evolution has dictated biological rhythmicity and physiology influenced by natural life cycle. Repeated perturbations of this cycle would have biological consequences. Now, I would like everyone to take a pen and a paper and write down, based on your area, what is that perturbation? What is that consequence based on your area? So write down one word, just the first one that comes to your mind. In your area of work, or what is the consequence of being stuck in a biological darkness? And people in the chat, they can just write down to us. Marianne is monitoring that. So I would like a neurologist to tell us what they wrote. Beautiful. Maybe one more word. Yes. Depression. Thank you. Can we get a few words from the audience? Not yet. Okay. Well, hopefully you guys are not stuck in biological darkness, however. Maybe we get one more word, what you wrote. What are the consequences? Hunger. Well, that's true. The actually craving for carbs and sweets, it has been linked to the circadian misalignment. So I wrote down some of these disturbances, and you have obviously in your area of work can share with us a lot more. But well, we know daylight triggers non-visual photoreceptors. modulating our body's clock, mood and depression have been linked and actually has causal effect on mood and depression, sleep wake cycle, cognitive performance, and as goes on, you know, digestive system, cardiovascular system, heart rate, they are changed by the same system that is modulated by the circadian clock. So there is a very close contact, especially based on the timing. It's not just about presence of this type of light. It's not just about, we get an electric light, it has that spectrum, but it's also about proper timing. And that timing is influencing our CSN, which then changes these elements. Oh, and then you're familiar with this beautiful graph, right? What is the gray area? The gray area is the spectrum of our sun. And beautifully, our biology adapted to try to capture as much stimulant as possible. And you guys know what those two lines are. The yellow line, what is the yellow line? The visual curve, exactly. That's what our eye sees. And what's the blue line? Exactly. And so that is what our body sees. Oh, nice. This is our body sees. And our body sees a level of external lighting stimulant that our eyes doesn't see, but our body is modulating itself. And so these two vary. And just for fun, the red one is the fluorescent light where we have in our workspace. That shows you how much nutrition our biological clock is getting to keep our doctors at their best. And just letting you know, we have actually studies that indicate these lack of lighting exposures causing more errors in our healthcare workers. All right, so the image on the left, so there are more, I wonder if anybody talked about, when you wrote a word or thought about the word, talked about the behavioral consequences of being in biological darkness. The image on the left shows a study we did on 120 healthcare workers about the mechanisms they take when they feel lowered alertness. And as you see here, you notice a lot of people self-medicate with caffeine. They take sugary beverages. We had a lot of energy drinks in the hands of people. And some people smoke and some people just go for a walk. That's a healthier behavior. So so that can be another level of consequence, maybe nutritional or dietary craving, etc., that might be as a result of this. The image on the right is another relevant study. In 2 environments, we tracked the same people, each for 12 hours. We did PDA recording of their behavior. Now, these are nurses who work in these 2 wards, different weeks. And we noticed many behavioral patterns. For example, one significant finding was significantly lower communication, work-related and non-work-related communication, when they were in the windowless ward. So what is it that the circadian rhythm is leading to? But now communication is linked to a healthcare outcome, right? We know that. So better communication is important. So we are looking at better work and living environment. And we know, and evidence previously has shown that daylight is the #1 modulator of environmental factors on the body. So it has the highest effect from all the environmental stimuli on our circadian clock. It's #1. So we did a follow-up study to try to understand that within a wide range of population. And we found something really interesting about the diversity of the fabric of the population. So we did 2 studies, one on 130 healthcare workers, the other one on a representative sample. No way. We're going to have all over 20 minutes? Almost? Okay. Representative sample of healthcare, representative sample of New York State employees. So these are all the employees you can imagine: lawyers, bus drivers, teachers, everybody. So we looked at the way they cope. What they find is more alerting, and in the work environment, what they need, and also how they cope and what they have access to cope with loss of alertness at work. And consistently, daylight was on the top 2 choices for alerting factor in the workplace. But we also interestingly found that people with lower socioeconomic status had lower access to those alerting elements. So they also come with higher risk. So those are people who have 2-shift jobs, they're not sleeping probably well, and when they come to work, they don't have the corner office, so they don't get as much exposure to light. The second study was in the home environment. This brilliant researcher, a PhD student from Iran, Zahra Javani, who I had the pleasure to co-advise remotely, she did a study on a housewife in a city called Isfahan, center of Iran. It's a mid-sized city. And she did a correlated mood with size of the window in the homes. And 90% of the women in this town are housewives. And she found a strong correlation between the mood and happiness with the size of the window and daylight exposure in the homes, where they were spending a lot of time at home. Because of time, I will be very quick, because I would like to set a few questions for the conversation we'll have on the panel. Just talking about vulnerable populations, we worked with the authorities closely to translate voices of stakeholders and research into our new code. So building code for healthcare facilities and residential facilities in the US just adapted some new measures to especially be sensitive to the needs of vulnerable population, people with advanced illness, because they have more needs and they are more restricted in how they can access to daylight or other elements. There are 3 questions that I would like to entertain with us, and Judith, who is moderating the panel, had a couple of these questions as well. And I look forward to the discussion where Matthias Michel and from the members of the parliament and Alejandro will be joining online. So we'll have this discussion. So I would like you to write down your answer to these 3 questions. The first question is, how many years does it take for a research from the time it's published to the time it comes to the real world? Write it down, how many times. And people in the chat, please send to Marion. How many years does it take from research from the moment it's published to the moment it comes to the real world? How many people in the room, show of hand, they think it's about a year or less? About 1%, about 5 years to 1 year to 5 year, show of hand. Show of hand, 5 year to 10 year. Okay, good. 10 year to 30 years. More than 30 years. Good. All right. So, well, we are very optimistic. I'm really happy to see optimistic crowd. Well, the average is 30 years, but yeah, that's just the average. But okay, well, it took 264 years for us to know citrus is a cure for scurvy until the Navy ships implemented it so it really is complex. So that leads us to the next 2 questions. Who are the players? Who are the players? So I would like to ask, how many people, so can you think of one word? Who are the players that can bring research to impact? According to World Health Organization, these are the players. And of course, you guys might expand on that. But the key here that I would like to discuss is that World Health Organization believes that research is rarely applied from a top-down linear model to practice. It is actually co-created from a bottom-up in collaboration. A research that's implemented is co-created in collaboration with policymakers, with community, with researchers together. And in enactment of conversation, so in a reciprocal dialogue, it's created. Why the slides keep running on me? So it's using the football metaphor or soccer metaphor, depending on where you come from. So it's about passing the ball to each other and keeping an eye on the goal. Researcher is only a stakeholder in this model. So I hope we will further challenge this together. The last question is, what are the barriers? Can you think of one barrier that for research to take 200 years or 30 years to come to benefit us? Sorry? Trust and education are the barriers. Very good. One word, maybe somebody can come from the audience. What are the barriers? Monica policy. So that's WHO describes 3 categories of barriers. We could expand that. So policy, the second one is all the steps for translation, like the valley of death for the entrepreneurs, the policy regulation, the bringing things to market. False beliefs. Okay, so, and we talked about education as well and trust that came up. I'm giving 1 minute. Thank you so much for being generous. So the third one is all encompasses that. So the third one is very interesting to me. Uptake of design and research solution within a specific context. So culture, tradition, beliefs, habits, false information, trust, education, all that elements is the third element. The first element we didn't talk about, interestingly, it is actually the part about the supply of research. So it's the supply part of the architecture, or it may be not, research is not diverse enough. We don't have it for all people, like it's mainly for the mainstream. So we will look forward to have this conversation together in the panel. The last part I hope we can talk about in the panel is about the role of bringing our past knowledge from the vernacular and older, kind of the older generations like the Maya and the you know, what is it the past knowledge, the previous generations knew about how to design for daylight that we could learn from. This is my last slide. Happy about that. This is the constellation of the people Daylight Academy brings together. And hopefully you all see yourself here. And really our goal here, and the question for us to then carry on to the panel discussion is, how can we work together to create, to facilitate this research to impact, to create better work and living environments, to create positive change for the physical environment, to improve equity and also quality of life for people. Thank you.